We have a special edition of What Our Eye is on tonight. We're revisiting the questions that have come up from so many people on social media after seeing the Wendy Williams documentary. It was released by Lifetime over the weekend, and we did touch on it at the beginning of the week, but now we're going to dive a bit deeper. Tonight, we're focusing on questions surrounding frontotemporal dementia. And before we get into a conversation with our expert tonight, I want to give you just a few facts that we researched from the Alzheimer's Association. So more than 6 million Americans right now are living with Alzheimer's, and by 2050, that number could rise to 13 million. Then we have 1 in 3 seniors who are dying from the disease, even other types of dementia. It actually kills more of our seniors than breast cancer and prostate cancer combined. Now, the lifetime risk for Alzheimer's, according to this data, is at age 45. It's 1 in 5 for women and then 1 in 10 for men. Think about those stats for just a moment. I mean, if we gather everyone that's behind the scenes right now, we have those stats right now. Only 4 in 10 Americans, and this is really important, only 4 in 10 Americans would actually talk to their doctor right away when they're experiencing any sort of early memory or cognitive loss. So I want to bring in the expert that we have with us from Baylor Scott White tonight, Dr. Claudia Padilla. She specializes in behavioral neurology and is the medical director of such at Baylor Scott White. First of all, Dr. Padilla, I would like to thank you for joining us here tonight, because I know you're very busy seeing patients actively and dealing with this every single day.
Thank you so much. It's great to be here.
So the first thing I want to ask you is, the world was really watching, and Wendy Williams, she's a star in her own right. Bruce Willis has the same exact type of dementia that we're about to talk about. But for folks at home who've never heard of this or really want to know more about this, can you break down what is frontotemporal dementia?
Sure. Frontotemporal dementia is a type of dementia or neurodegenerative disease that primarily affects the frontal and temporal regions of the brain. And there are several different subtypes or kinds of frontotemporal dementia. One of those are behavioral variant, which affects somebody's personality and behavior. There are other types that affect language or communication more, and there are other types that affect somebody's movement or motor abilities. So there's a lot of different types under the general heading of the frontotemporal dementia disorders or diseases.
And I know this is such a complicated disease in its own right, and then to have a like you said, a subtype of this disease is really challenging. The world was watching, and I think, the response on social media was people were having trouble rectifying Wendy Williams and her boisterous personality with the Wendy that they were seeing, who was clearly not well. Can you talk to me about what people who are dealing with this behind the scenes in real life, what should they be looking for? What are the signs of decline when we start to talk about cognitive health?
So depending on what type of dementia we're talking about, overall, we want to look for any changes in memory, any changes in, let's say, regular everyday life. For example, if we are having trouble or more trouble keeping up with appointments, or repeating ourselves, or having trouble coming up with the word. In the specific case of Wendy Williams, I'm not her doctor that's treating her, but from what I've read, being classified under the frontotemporal disorders, we would tend to see personality changes from the individual or behavior changes, even, changes in their eating habits. So there's a lot of different types of symptoms that we look at. And we encourage individuals or people to definitely talk with their primary care doctors or internal medicine doctors and get help and an evaluation right away.
Now, is there any sort of research that would explain the use of alcohol and drugs, whether the drugs are illegal or not? Can that make this worse?
Definitely, we know that chronic excessive alcohol use can have a negative impact on the brain. especially the memory regions of the brain, especially the frontal lobes of the brain. And so we see dementias that are primary causes from alcohol use or drug use, but then also they are big contributors to dementias and declining cognitive health.
Now, a lot of people are dealing with this in the privacy of their own homes. This is playing out for the world to see. Is there any sort of advice that you would give, and not specifically to Wendy Williams or her camp, but just to people dealing with this behind closed doors, not really knowing what to do? Because I think it's hard for anyone in this position to watch someone that they know and care about and are used to seeing in a different way decline. So what's your advice to their caregivers, to the support tribe around them?
Yeah. It's definitely so difficult, and, talking with caregivers, families, and support people every day. It's just so important to reach out to friends and family, make sure that the individual is supported as possible, getting connected with resources, whether it's the Alzheimer's Association or some type of association that has information and resources so that the individual and the caregiver have the support that they need while going through the journey.
Now, I read also from the Alzheimer's Association that Black Americans, which Wendy is, are twice as likely to deal with these sort of cognitive issues. What's your advice to the Black community, Black people, Black doctors, for looking for signs, especially with that stat you just heard, 1 in 4 Americans won't even tell their doctor that they're struggling with cognitive decline?
I would say, hopefully there is more dialogue with the primary care physicians or the internal medicine physicians, who are the physicians sort of that the individual will see first. Asking them, more about their cognition, their memory, and having that open dialogue so that they can get evaluations with specialists earlier so that we can diagnose and treat these conditions earlier.
Now, you are the expert, Dr. Padilla, so is there anything that I didn't ask you that you want to take this platform and this opportunity to share with our viewers tonight about this?
Sure. Thank you so much for asking that. I think that it's just really important to, get an evaluation early and hopefully get an accurate diagnosis so that if there is a potential treatment for the type of cognitive decline or dementia that it's occurring, the individual does get help. There are definitely a lot of resources. The Alzheimer's Association and the Association for Frontotemporal Degeneration is also a great association that has a lot of resources for individuals and caregivers.
Such great insight, Dr. Claudia Padilla from Baylor Scott White. We appreciate you joining us here tonight. Thank you.